This presentation is on the integumentary system. So just a little intro. The skin is the largest organ in the body. It is composed of the epidermis, dermis, and subcutaneous tissue. It helps to protect, regulate temperature, helps with waterproofing, and helps with feeling. This also includes the hair, nails, sweat, and sebaceous glands. The epidermis it regulates the body temperature and acts as protection of the skin. The outermost layer of the skin, it is the outermost layer of the skin, and it is separated into 5 layers. These being the stratum corneum, the stratum lucidium, the stratum granulosum, stratum spinosum, and stratum basale. Next level is the dermis. This is the middle layer of the skin. It has hair follicles, nerve endings, blood capillaries, fibers, and cutaneous glands. It is responsible for feeling touch, pain, warmth, cold, and has many different sweat glands. It also produces sebum, which is a waxy, oily substance that keeps the skin moisturized. Next level is the subcutaneous tissue. This is the deepest layer of the skin. It stores fat, insulates heat, and is the cushioning layer. It contains connective tissues, nerves, and has blood vessels. It also contains macrophages, which are cells that work to protect and are part of the immune system. Some of the benefits of exercise on the skin are that the increased blood flow helps continue the flow of oxygen throughout the skin. It nourishes and energizes the body and helps prevent strokes, heart attacks, and other heart conditions. The flow of blood with circulation also remove toxins and helps sweat out those toxins through sweating and get rid of the acne. Some precautions to consider are some skin conditions such as acne, burns, psoriasis, which affect the versatility of the patient in their exercise. Not only can this limit people physically, but also mentally. This creates a negative self-image for themselves and then negatively impacts their health. As a potential physical therapist or dietitian, offering other food options or other customized training if you're working with the patient is things to consider. Some skin injuries. First-degree burn is the most common. This just results in redness and pain, and some common examples is just sunburn. Second-degree burn involves the epidermis and dermis, and this results in redness, swelling, and a protrusion of a potential blister. The third-degree burn involves the epidermis, dermis, and subcutaneous tissue. There is no pain because all the nerve endings are completely burned. Some healing techniques. The skin either heals through regeneration or fibrosis. Regeneration is when the wound is patched and repaired with tissues that were not totally destroyed, and fibrosis is an injured area repaired with scar tissue and not all ability is fully restored. Also, through inflammation, this lets people know that the area of the injury and the redness and swelling and pain allows the person to identify the location. And that's the sources.